Welcome to the Salem Sump tube with Kangaroo multifunctional port with ENFit connection training video. From this video, you will learn about the features of the Kangaroo multifunctional port with ENFit connection, the recommended use of the anti-reflux valve with the Kangaroo multifunctional port with ENFit connection, and commonly asked questions and recommendations for responding. Features of the Salem Sump tube with Kangaroo multifunctional port with ENFit connection. The Salem Sump tube with Kangaroo multifunctional port with ENFit connection is designed as an all-in-one system that allows clinicians to suction, feed, medicate, check residuals, and irrigate by toggling between functions. Suction. The primary function of a Salem Sump tube is to decompress the stomach. The Salem Sump tube with Kangaroo multifunctional port with ENFit connection can be used for suctioning the same as a standard Salem Sump tube. The universal suction adapter features a universal connection with no ancillary adapter needed. The integrated anti-reflux valve helps prevent stomach wall invagination during suction and reduces gastric reflux. To suction using the Salem Sump tube with Kangaroo multifunctional port with ENFit connection, using a quarter twist, securely push the suction line over the port. Toggle the selection knob until the indicator line on the knob is aligned with the indicator of the suction port. Listen for an audible click. Begin suctioning. Feed. The Salem Sump tube with Kangaroo multifunctional port can be used for enteral feeding. The system is designed to connect to Kangaroo enteral feeding sets, which are ENFit compatible, and monoject enteral syringes with ENFit connections. If there is a transition connector on your Kangaroo feeding set, twist and take off the transition connector. To feed using the Salem Sump tube with Kangaroo multifunctional port with ENFit connection, attach the enteral feeding adapter to the feed port. Secure the ENFit adapter to the port by applying pressure and a quarter turn. Toggle the selection knob until the indicator line on the knob is aligned with the indicator of the feed port. Listen for an audible click. Initiate feeding per facility protocol. Medicate. The Salem Sump tube with Kangaroo multifunctional port can be used for delivery of medication. The system is designed to connect with monoject enteral syringes with ENFit connections. To deliver medication using the Salem Sump tube with Kangaroo multifunctional port, disconnect the feeding set from the ENFit port with a quarter twist. If the Kangaroo enteral feeding tube set is still connected to the Kangaroo multifunctional port, connect the monoject enteral syringe with ENFit connection using a quarter turn for a secure seal. Administer the desired medication to the patient per the order. When finished, twist to disconnect the syringe and reconnect the enteral feeding set with a quarter twist. Checking residuals and irrigating. The Salem Sump tube with Kangaroo multifunctional port can be used for checking residuals and irrigation. The system is designed to connect with an ENFit syringe. To check residuals with Salem Sump tube with Kangaroo multifunctional port, attach the end of an ENFit syringe into the feed medication port with a push and quarter twist. Gently pull back on the plunger to withdraw any stomach contents. Check the amount in the syringe. Depending on the amount of aspirated gastric fluid, follow facility protocol for replacing or discarding the gastric residuals. It is recommended to flush 10 to 20 cc of water or saline after checking gastric residuals. After flushing, disconnect the end of your ENFit syringe with a quarter twist. When irrigating or providing intermittent flushing via the Kangaroo multifunctional port, the use of water or saline is recommended with the ENFit syringe. If irrigation has been administered, it is recommended to administer a bolus of 10 to 20 cc's of air or saline through the anti-reflux valve with an irrigation syringe. Locking. The Salem Sump tube with kangaroo multifunctional port can be locked to reduce leakage during transportation. The toggle in the setter allows to toggle between suction and feed Medicaid, but when not in use, there is a setter slot which will close all ports. There is an anti-tamper lock which can be activated if you slide the setter toggle down. You will see a visible lock. This indicates that the multifunctional port is locked into whatever orientation you have selected. Kangaroo multifunctional port frequently asked questions. Discussion around key troubleshooting questions. Question: what should be done if we notice gastric contents are leaking out of the ARV port? Answer: the multifunctional port requires a reset of an air buffer after every flush of water or saline when flushing out the anti-reflux valve port. Injecting 10 to 20 cc's of air into the port after the flush will prevent further gastric leakage. Question: how do I know if I have a firm connection with the toggle switch? Answer: the Kangaroo multifunctional port was designed to have an audible click when it is fully switched between the different settings. If you have not heard an audible click, try and toggle it again. You can also check the back for the alignment arrows. Question: what type of syringe works to flush or provide air buffer for the anti-reflux valve? Answer: only an irrigation syringe will work with the anti-reflux valve port on the Kangaroo multifunctional port. Other syringes may not provide a tight enough seal for flushing or air insertion.